In the United States, more than 100,000 people have been infected with the coronavirus. That's more confirmed cases than in any other country. But according to health experts, the country needs to do more to reveal the extent of the outbreak. To help achieve that, the U.S. Food and Drug Administration has approved a new rapid test from Abbott Laboratories. The company says the test can detect the coronavirus in about 5 minutes and is so small, the size of a toaster, that it can be used in almost any healthcare setting. It plans to supply 50,000 tests a day starting April the 1st. And to look into this, I'm joined now by Dr. Eric Fagel-Ding, an epidemiologist and health economist at the Harvard Chan School of Public Health. Thank you for joining us, Doctor. Is this test for real? It almost sounds too good to be true.
It's definitely real, and the technology has evolved a lot in the last few years to make this possible. And I'm still waiting for to see some of the accuracy measures, because I think those still have to be peer-reviewed and published. But any test right now is much better than the one we have right now, which takes almost a whole day turnaround and is only 30 to 50% accurate. So this test that is on a rapid scale can immediately tell people you need to be quarantined or not, would be infinitely better and faster in terms of helping us contain this virus than what we have now.
In January, experts were already warning this disaster could spread beyond China's borders, and you were one of them. Why did the U.S. not take this threat seriously?
Well, the U.S. was under a lot of other busy things like impeachment during that time. And I think sometimes it's really hard to imagine the almost the apocalypse compared to what people can want to believe, because it is almost so hard to believe that we have this kind of global recession, depression upon us, and people being locked in their homes, compared to what was just happening. And people don't want to accept that is the reality. And oftentimes the governments are frozen, and sometimes they just want to, keep calm and carry on. But sometimes that is not what you need to do. Sometimes you need to activate getting the tests ready, getting masks ready, ventilators. All these processes should have been started months ago.
Okay, well, I'd like to ask you about President Trump, because he at first was saying this wasn't really a problem, and then suddenly he began to take stronger measures under criticism, most recently the $2 trillion bailout, which came from the Senate, and then telling General Motors to make ventilators. So that's all good, but has the government waited too long in the U.S.?
Yeah, it's initially him calling it a hoax or just corona flu and saying that, it's just a flu and you can still go to work with it was just the wrong thing. It was this is the first time in which misinformation came from the top, and it wasn't just a silly misinformation, but actually costed tons of lives. This virus previously had a doubling time of 6 days, which means, missing 3 weeks meant 200 cases becomes 4, becomes 8, becomes 1,600 cases. Within just a few weeks, we've potentially missed 10x or 50x the number of cases and illnesses that we could have prevented had we moved faster. And this is failure in political leadership in the worst extreme. And now we have this pandemic on our hands, and it's obviously the fault of many governments who fail to react, and we're paying the price.
You were speaking of many governments being involved. How is the world? Sorry for interrupting you there. You were talking about many governments being involved. How is the world overall dealing with COVID-19, and can countries fix it alone?
Yeah, so in terms of vaccine production, vaccines will be the ultimate solution for it. But vaccine, unfortunately, is still about 1 year to 18 months away. Maybe we can find drugs that will work much sooner, within 5 to 6 months of ramp up. But all these kind of things takes international collaboration. And in terms of supplies, actually, Germany is actually the number one source for reagents to conduct the laboratory tests. in which we have a global shortage on. And all these supply chains from masks and ventilators, all these things require global supply chains. And this is why the world has to come together, not get caught up in trade disputes and tariffs. This is the time for us to come together as a human race to create a Manhattan Project to solve this epidemic before it kills millions.
A global problem requiring a global answer then. Dr. Eric Fagel-Ding, epidemiologist and health economist at the Harvard Chan School of Public Health. Thank you for that.